number. Not me. I don't have time for this. I've got little kids. I've got a career. So in the moment that someone's diagnosed, it's difficult to process the information. So they have a visit with their imaging center or the breast cancer doctor that they're referred to. And in all likelihood, it's probably fairly ethereal in their minds, very clouded. And then there's a moment of implosion of your normal world. the facing of your own mortality and the worry for disfigurement, worry for chemotherapy, losing your hair, what's going to happen to my family, what about my husband, who's going to take care of my children, all that crashes in. And so in most cases, my guess is that women then go into a mode of sort of following whatever they're told without much question because it's too much to process. And so almost becomes a passive event rather than something that you're in a position of strength to take charge of. And that's a vulnerable situation. That's a vulnerable moment. And what we need to do now in this information age with organizations like I'm Taking Charge is to change that dynamic a little bit. Because in that moment, you need to have a little bit of power. You can't be totally passive because you risk the possibility that the choices being made for you might or might not ultimately be in your best interest or lead to the best outcome or be in the best place or whatever. It's always very important to question everything. Not that you're going to have bad treatment or that people don't have your best interest at heart. But if you don't have knowledge, if you don't have some kind of resource that you can go to that's simple and concise and speaks in clear, real-world terms, it becomes a tornado around a moment of chaos where the information then becomes the problem. There's too much of it. It's coming from 8 different directions. My neighbor said this. My other doctor said that. I heard about this on the internet. I saw a TV show about that. It's almost impossible to process. And so what happens in the moment where someone's diagnosed? My estimate is a summation of all of those things. And most of the time things work out well, but sometimes they don't.